It's a blood pressure issue.
It's a Monday morning at Emory University Hospital's emergency room.
Do next night's echo. Yeah, let's do that.
But most cases aren't emergencies. Physician assistant Christiane French handles 1/3 of the patients on her shift.
I would say at least half, if not closer to 75% of the people could be cared for in an outside facility.
Case in point, this woman who has a rash.
Most rashes are not a medical emergency.
And why do they come here?
It's convenient. You don't have an appointment. You don't need an appointment.
And you don't need insurance. But these days, many even with insurance opt for the ER.
Hi, Miss Green. I'm Christiane. How do you do? Okay. So tell me what happened with your foot.
I stepped in a hole and then my foot twisted.
Miss Green is a 52-year-old lady who came to the first resource that she knew to come to, which was the ER.
Straining an overwhelmed system, CDC numbers show that 124 million people visited emergency rooms in 2008, up from nearly 117 million in 2007. Dr. Stephen Pitts expects those numbers to grow. His study was published in the medical journal Health Affairs.
Our study showed that when somebody in America gets sick or injured, over half the time they bypass the primary care doctor and go to the ER or to a specialist.
Pitts says doctors' schedules are a big reason why.
The reimbursement levels are so low that if they were not to crank out a patient every 15 minutes, they wouldn't be able to stay in business.
While the number of non-urgent medical visits in the past year have actually gone down, the American College of ER Physicians foresees a potential problem with an increased demand for doctors. Healthcare reform means more Americans will be insured. And Dr. Nicholas Vasquez says there's no quick fix to meet that expected need.
There's enough demand out there that you can try and throw a lot of doctors at it, but it takes somewhere around 10 to 15 years to educate a new doc.
What does it mean for the future of emergency rooms like this one?
In 2014, the Medicaid expansion takes place, and that means a lot more people will be insured. But those people will find that there's an insufficient number of primary care doctors to see them, and I'm fairly certain that a lot of them will end up here with their problems.
And while healthcare reform has provisions that are expected to help meet the demand of more patients, they're seen as long-term solutions. Mary Snow, CNN, Atlanta.